When I was 8 years old, I started to have a lot of pain in my left knee. We were referred to the Robert Jones and Agnes Hunt Orthopedic Hospital in Oswestry under the care of Mr. Evans. After having some tests and x-rays, we were shocked to discover it was actually my hip that was the problem. It was 70% dislocated. My parents had lots of discussions with the surgeons about what was the best thing to do, and it was decided I would have a surgery called a left femoral shortening osteotomy. This would ensure my hip stayed within its socket and made it stable, but I would lose a little of the length of my left leg. They would put a plate and some pins in to hold it all together, and later on I would have to come back and have these removed in a few years, they said. I went into the hospital the night before my planned surgery, and I was first on the list the following morning. I was really nervous as I had never had an anesthetic before. The team were really good and I was asleep without any fuss. The surgery lasted about 6 hours altogether. When I woke up, I was on a high dependency unit. I had a full body spiker on. This is a plaster that literally goes from across your chest all the way down to your ankles. There is a hole cut out for your tummy and around your groin area for personal care. I had an epidural in and was on morphine and other drugs. Sadly, because of this swelling, the cast became too tight in my groin and it had to be altered, which was not a nice experience. My epidural also came out during this, so I had to be fitted with a syringe driver for the morphine. The anesthetic made me really sick also, and they literally had to turn me on my side to be sick. I looked like a starfish in my rock-hard cast. Once the cast was set, after 24 hours, another colored layer was placed over the top of the white plaster to make it extra hard and stable. I had chosen a yellow color. I was also laid on a wooden perch that had been specially made for the shape and size on my body. This was to make sure there was no pressure on the cast. We all laughed and said I looked like a canary on my perch. After only a few days in hospital, I was allowed to go home. An ambulance had to take me home as I could only lay flat and could not go in our own car. We brought the perch home also, as I would need to lie on this all the time. I was at home for 6 weeks in the spiker cast. They loaned us a special buggy that I would lay in, so at least my mum could take me for some fresh air. My school also sent me work home to do, so I did not miss out too much. After 6 weeks, an ambulance came back to collect me and I was taken back to the hospital to have my cast removed. They split the cast literally in 2 pieces, a front and a back. I had to stay in the back of the cast when I was laid down, as due to my cerebral palsy and being kept in the same position for 6 weeks, my muscles were very tight and this helped them to not spasm so much. I had daily hydrotherapy and physiotherapy to help get my legs and hips moving again. I also got to see my scar for the first time. It was a large scar that was on the outside on my thigh. I stayed in hospital for a week so I could have intensive therapy each day to help me recover. After a week, I was allowed to come home, and the physiotherapy and hydrotherapy could be carried out during the day whilst I was at my school, as they had the facilities there.